So welcome back to everyone who's been here for the past few sessions, and welcome to those who are new and joining for the first time tonight to our Rural and Remote Nursing and Midwifery webinar series, looking at professionalism in the context of rural and remote practice. So for those of you who don't know me, my name is Pip and I work in the Future Workforce team at the New South Wales Rural Doctors Network. I also come from a rural and remote nursing background and am very passionate about not just rural nursing, but rural health in general. So once again here tonight, I have Chris Russell from the Future Workforce team, and he might join me a bit later in moderating some of the questions. So Chris will pop in and say g'day then. Before we get started though, I would like to acknowledge and pay my respect to the traditional custodians of all the lands on which we are meeting on today, and pay respect to elders past, present and emerging. So as usual, we'll go through a quick bit of housekeeping. So if it's all right, I'll make sure that we use the chat function. So you'll see I've been chatting in it already. So you have the option to use panelists or panelists and attendees. And please feel very welcome to post questions throughout our session in there. Some of you sometimes use the Q&A, that's fine as well. I will answer those questions, but it's nice to make sure we keep them all together in the chat function. So try and do that. If you have any tech issues throughout, just also either email the address you had in your registration link, or else let us know in the chat function if that's possible also. And anything else, we'll see if we can fix along the way. So as many of you are aware, this week's session is a bit of a deeper dive into what it's like to be a new grad in a rural and remote location. And we're looking a little bit more into professionalism. So we have Marcia from CRANAplus presenting on professionalism in the context of rural and remote nursing and midwifery. Marcia comes from a nursing background herself, and we'll talk into aspects of your new grad that are not only imperative to safe quality nursing practice, but also your professional scope and self-care also. Marcia's presentation will touch on transitional shock, often experienced by new grad nurses and midwives, scope of practice, autonomy, working in isolation, as well as some CRANAplus support services that are available, and I really encourage you to make note of them. So without further ado, I'll hand over to Marcia and we'll make sure we do some questions at the end. Thanks, Marcia. Okay, I'll stop my share.
Okay, and over to here. Okay, all right. Well, I seem to have worked the technology okay, so it's all good. So thank you, Philippa and Chris, and hi everybody. I must firstly say thank you for the invitation to be part of the New South Wales Rural Doctors Network Rural and Remote Nursing and Midwifery webinar series to talk about professionalism in the context of rural and remote. Before I begin, I would like to also make acknowledgement of country. In the keeping with the spirit of reconciliation, I would like to acknowledge the traditional owners on whose land we meet today and pay my respects to elders past and present and future leaders. As Philippa has actually outlined, we will be talking about transition shock, reflective practice, scope of practice, rural and nursing and midwifery, remote area nursing and midwifery, and RAN certification and CRANAplus resources. This is what the session will be in the next 45-50 minutes, so bear with me and come along with me. So what is transition shock? Transition shock is a relatively new concept. It's built on the knowledge of cultural shock and comes from the theory of role adaptation. Occurs over the first 4 months of professional practice. Fear is a key driver. Transition shock describes experience of moving from a comfortable, familiar role, like, you know, you're in your comfort zone of being a pre-registered student nurse to a professional registered nurse. Fear comes, as I've just said before, as a key driver, and being exposed as being incompetent, providing unsafe care and causing harm inadvertently, not being able to cope with the responsibilities. And you want to be seen as being competent, providing safe care, being resilient and taking on those responsibilities. And this often leads to feelings of being exhausted in trying to stabilise the emotional roller coaster of self-doubt and exhaustion. There are 4 stages of transition shock. And let me tell you that it doesn't matter whether you are starting out on a new career or whether you are changing your career pathway. Everyone goes through it to varying degrees. Can I actually also say that often when you're in that sort of feeling very vulnerable, you often hear words like, I'm drowning, oh, it's so stressful, oh, so scared to death, etc. But however, just remember that transition shock only occurs in the first 4 months of professional practice as such. So the stages are the honeymoon phase, the shock phase, the recovery phase, and the resolution phase. The honeymoon phase it first occurs when you're optimistic about your professional role. You're excited about having secured paid employment and commencing your chosen career. You've got idealism, excitement and optimism. Orientation and supernumerary happens during this time. Then reality sets in when you find yourself with the disparity between what you have taught and expected to do. So the honeymoon phase is over and the shock phase or transition phase sets in. The shock phase is you will feel emotional. There will be deliberate withdrawal from intensity of the shock. You may have emotional withdrawal from others, feelings of rejection towards others, possibly hostility, fatigue, and may become ill with coughs and colds and headaches and just not feeling well. And this is sort of the shock phase, and recognise that this is a process of you moving through. However, equipped with the right tools, which I'll talk about in the next slide, we'll navigate through this to a recovery phase where there is reduced anxiety and an increased coping ability. And then you move into the resolution phase, which can either be negative or positive. You can move, so you can have successful transition to feeling confident and competent practitioner, or burnout and possible decision to leave the practice. So this is well documented, and this is the research was from Erin Wakefield, and she talks about it about new graduates suffering from transition shock. It's a good read and to have a look at it, but recognise that everyone goes through this in varying degrees.
Sorry, Marcia, I've just realised I think your view might be wrong. Up the top, can you see display settings?
Yes.
Maybe just click that. Yeah. Is that all right? There we go. Can you still see that okay?
Yes, yes. Can you
that's better. I think we just had a few slides on one.
Okay, beg your pardon. Okay.
That's okay. Sorry to interrupt you. Thank you so much.
That's fine. Okay, so the solution to actually moving through from the honeymoon phase to the resolution phase is all about self-care, seeking out supportive preceptors and people, and journal writing. So let's start off with self-care first. Self-care is about taking care of yourself first, and it's about if you don't take care of yourself first, you will not be able to look after others. So it's important, you know, mindfulness has become very, very popular with a lot of people who are looking after themselves. It's important to eat well, sleep well, spend time with family and friends, and exercise. Exercise is in the morning. Exercise often gives you clarity of thought, bushwalking and reading, but it is time out for you, and you need to build that into your practice on your days off or whatever. Also, seek out supportive preceptors and educator. a mentor. Mentors come in various degrees, can either be informal or formal. I will talk about the links mentoring program that CRANAplus offers to those that are new grads, and also those that are venturing to rural and the remote sectors. Supportive professional colleagues, talk about your day, share your stories. And journal writing, I can't emphasize this enough, but to keep a journal, track your progress, jot down what you've learned at the end of the shift. Because journal writing is a skill that actually helps you with reflective practice. And reflective practice is a successful learning tool that you can use. And I imagine you have actually been I guess you've been shown this during your undergraduate studies, etc., about and people have talked about reflective practice. But this is a really good, I guess, a conceptual understanding of what reflective practice cycle's about. It's like the description: what happened, what were your feelings, what were you thinking and feeling, and then to evaluate what was good and bad about the experience. What sense can you make of the situation? What else could you have done? If it rose again, what would you do? This cycle, it's the Gibbs cycle, it's a reflective practice cycle, allows you to then put it down on paper, and it's about learning from your experience. It's experiential learning. And if you do jot down your new learnings, it's a great way to look back and see how you've progressed over time. Reflective practice assists you in moving forward and working within your scope of practice competently and capably. It's also, like I've said, it's a successful learning tool. It increases your self-awareness as part of emotional intelligence. It draws on our knowledge, skills and capabilities in workplace practices, understands more deeply, makes intuitive knowledge shareable with others, and that's important. And it is the cornerstone of good clinical judgment and clinical competence, because you can draw on those learnings that you've made a note of and that you've actually recognised. So one of the key things I would say is to keep a journal, a notebook, jot down your new learnings. And it does help you to move forward and work within your scope of practice, as I've said. What is a scope of practice? It's the full spectrum of roles, functions, responsibilities, activities, decision-making capacity, and you need to be educated, competent and authorised to perform. You are also registered by the Nurses Board, Nursing and Midwifery Board of Australia. You're registered to practice within the scope of your registration. And what guides and shapes your practice are professional standards, codes of ethics and the code of professional conduct. And the scope of practice, the actual scope of practice is influenced by the context. And what we're talking about today is the rural and remote nursing and midwifery context. Consumer health needs. In the rural sector, there's an ageing population, so when we're looking at consumer health needs, it would be about dealing with chronic diseases. In the remote, there's a high population of Aboriginal and Torres Strait Islander people, and again, your focus would be on chronic diseases such as rheumatic heart disease across the lifespan, diabetes, kidney disease, to name a few. Level of competence is reflected by education, qualifications and experience, the type of health services that are delivered, whether it is in a regional centre, small hospital or primary health clinic. Also, your policies and procedures and your protocols guide your practice and are driven by evidence-based practice as well as organisational culture. So there's a number of factors that actually influence your scope of practice. So when we're looking at going rural and looking at rural nursing and midwifery, they have a broad scope of practice, providing healthcare to and within their own rural communities. And a broad scope of practice across the lifespan, and often having to work across acute, emergency, aged care, palliative, mental health, perioperative, primary and health care. That what you know as a specialist generalist. I often think that this is really a very broad scope. It's also what I would consider nursing and midwifery is. The essence of nursing and midwifery is about being a specialist generalist with reduced access to clinical supports and assistance compared to their urban colleagues. And to be a specialist generalist requires skills and knowledge to match and attributes of flexibility, adaptability, reflectivity, innovation and resilience are essential. It is required to undertake multiple functions depending on the day. These include clinical care, health service management and clinical education. Rural nurses and midwives have a high profile and are part of the community. And they are also expected to respond to the health needs and emergencies as they occur. Now, as you can see in the previous slide, sorry, I beg your pardon. What I have got here is a website that you can actually have a look at, and it is on the CRANAplus website, and it's about going rural for your information. It's down the bottom of the slide. So being a generalist nursing, it's a unique needs of the community. The areas of practice include emergency care, and you need to, with emergency care, you have expanded triage, physical assessment, emergency stabilisation skills to initiate clinical interventions, often as initial responder in the clinical emergency. You also work collaboratively in advanced and extended clinical roles for continuous, comprehensive and coordinated care, utilising your limited available resources. You also work in acute and subacute care, chronic disease, wound management, aged care, community health, palliative care, maternity care. I'd like to talk about maternity care. Is predominantly provided by a dual qualified nurse midwife in small rural settings due to the workload demands. You will often find that midwives may be called upon to use their midwifery skills, say 40% of the time. The rest of the time they would work as a rural nurse. Rural nurses often have dual qualifications and additional skills and knowledge to meet the community's needs. And some of these extended clinical skills such as radiography, suturing, plastering and advanced life support. Nurse practitioner roles have an increasingly important role in health service delivery. There is a career pathway that many nurses and midwives. They tend to take up in their first few years a regional placement, then they move to a rural smaller hospital, and then a few years will think about going remote, and then after they've done a stint in remote, will often move on to international nursing. So I guess the important thing and the important message I want to actually say is explore the possibilities and be curious and ask questions when you're thinking about, or you've got a rural placement as your first, as a postgrad. And the things that you need to say is, what do I need to know about this community? What employment and other opportunities exist? And this is if you are married, exists for your partner and family. You also would look at the schooling. Will my internet and mobile phone service operate in the rural areas? What is the availability of local accommodation, short and long term? These are all really important questions that you need to find out and seek. And you either talk to people that are working in the rural sector, or speak to if you've got a placement already, speak to the local director of nursing. Find out if you need a driver's license and a vehicle. Is there a public transport available? What is the range of health services provided? What is the composition and size of the health service team? That's really important to know, how big or large your team that you will be working with. And what level of professional support is available? Is there orientation and induction, professional development and mentoring programs in place? And where can you seek out this support? So they are all the things that you need to consider, to be curious and ask questions about. They're also the questions that you need to be curious about if you're going on a remote placement. Now, this is a brochure that we have developed for those that are seeking to go remote, and so I'll just go through the preparation and the things that you need to consider. So when you're thinking about going remote, all aspects of your professional and personal life require equal attention. Because when you're thinking about going remote, living in a remote and isolated community, it's your professional career, your professional practice, your social life, your family, friends, and cultural safety and safety all need to be considered because of the geographical isolation. And the characteristics of a remote practice requires a comprehensive primary health care, and it's practiced across the lifespan. So you need to have exposure and have clinical skills in the area of acute and emergency care, chronic disease, and also public health. So like we talked about, exploring those questions of, getting underway, exploring the possibilities of going remote, I've actually gone through those questions that you would ask if you were going remote or you were going rural. And what skills and qualifications do I need to work remote? Support what kind? Again, orientation, induction, mentoring programs. And what do I need to know about this community? Very important to find out the demographics, the cultures, the general services. What kinds of services does the health service and clinic provide? Will I be able to take it? Often people say, will I be able to take a selfie and send it? And what type of accommodation? Accommodation is really important. Will it be share, or will I be actually living just in a flat of some sort, or a house? And what opportunities may exist for my partner or family? So step 3 is about following up, and it's about looking at the essential short courses and CPD activities. And you need to also be aware of current and state legislation. We have developed professional standards of remote practice out there for nurses and midwives, and your practice clinical manuals, your health service standards, and also we also have a support service that I will actually talk about. And you need to look at how you can keep yourself resilient, and ways of limiting professional and social isolation. And it is important to note that when you've done all this, you may be new to remote, however you will bring acquired knowledge, proven abilities and expertise, which over time will be enhanced and reflected as the expertise and practices of a experienced remote health professional. And that is very, very something to maintain or keep or hold on to, knowing that you might be novice to remote, but you do bring acquired knowledge and proven skills. So let me give you some tips for remote. So we did say before that there was a career progression from regional, rural, small hospital to remote to then international. So my tip for you is to consolidate your skills, build your skills as a generalist nurse prior to going remote. And I often encourage nurses and midwives to do at least 2 to 3 years of gaining experience and consolidating your capabilities. Do your homework. Ask people who are already working out in the remote area about remote practice. Do not feel pressured in taking the first offer. Examine your motivation. What is your motivation before you make a decision? Is your partner being relocated? Are you looking for a lifestyle change? Job satisfaction is linked to liking what you do and have a work environment congruent with your values and professional growth. Understand that to be a local, it often takes a generation, at least 20 years before you're recognised as a local. And this is the same in rural as it is in remote. Authenticity. It is important to be authentic because it is the cornerstone of building trust with your local community and also with staff members. Respect local healthcare workers and community workers. Follow protocols and guidelines. So in Northern Territory, Western Australia, South Australia, they use the CARPA manual, and in Queensland, Victoria, they use the Primary Clinical Care Manual. And seek advice whenever necessary. Do not take it upon yourself to work outside your scope of practice. If you don't know, ask. Confer with your professional and collegial networks. Ask your colleagues. Feel comfortable with your employer. You will need to feel confident that you can call and discuss concerns. CRANAplus does not support single post nurse or nurse posts. And we have a booklet on our website. You can visit our website. It's up here on the right-hand corner, Pathways to Professional Practice, for you to look at when you want to. Okay, let me talk about, we talked about professional standards, and we know that it guides and shapes your practice. And we have developed professional standards for remote practice. And this is an online self-assessment where you can commence this as as someone who's just starting out in the remote sector, but you often find people will actually submit their application to CRANAplus when they feel competent that they have met these 9 standards, and it's about demonstrating your practice against the 9 standards. So the first one is registration and certification. So you need to be registered with APRA. Standard 2 is about self-care and resilience. It's about how you look after yourself, and you need to, so as part of to meet this standard is that you develop a self-care plan. Standard 3 is about culturally being respectful or cultural safety, and it's evidence of attendance, cultural respectful training linked to CRANA with the program. Standard 4 is about demonstrating how you deliver comprehensive primary health care. Standard 5 is about pathways and collaborative practice, the importance of working in a multidisciplinary team, both in rural and remote. You work in a multidisciplinary team. Standard 6 and Standard 7 is to do with to provide evidence to demonstrate that you have clinical knowledge and skills in emergency care, advanced life support, medication management, maternity upskilling for non-midwives, maternity emergency for non-midwives, and assessment skills. So if you look at Standard 6, they are the key skills that you need to have to be a competent remote area nurse. Standard 7 is a recency of practice, which you'll provide the evidence in Standard 6. They are combined, 6 and 7. Standard 8 is about your CPD, and then standard 9 is safety and quality framework, that you practice in a safe and quality framework, and that you have and you are aware of the Code of Ethics and the National Safety and Quality Health Services Standards. So that's in a nutshell, but the process is that you submit an application, the actual assessment is online. You work with the assessors. If we feel that you need to update or you need to expand on your response to any of the standards, we would work with you to guide you through that. And at the end of the day, when you've met the standards, you get a certificate of RAN certification, and then you're placed on the CRANAplus register, and then you are certified as a remote area nurse for 3 years, and then the renewal starts again. And the benefits for this is that there's a safe, consistent, high quality of accessible healthcare. For the remote area nurse, it's about that professional recognition as a specialist role, and it provides clarity and confidence around your scope of practice. And for the employers, it's about knowing that the nurses that they employ do have an understanding of what's expected out there, and they do have the knowledge and skills to be a remote area nurse and to work competently and safely in that context. So CRANAplus also offers a number of resources. If you can see on the left-hand side of the screen, that is our website. We have a clinical governance guide which actually outlines what the standards are to work out there, and it brings it right down to what does this standard mean, what should be in place, what is my responsibility as a clinical manager, what is my responsibility as a clinician, and it outlines clearly how you would meet those standards. The next one is the Rapid Risk Assessment tool, and this is a framework for you to assess your safety in the clinic, in the community, and when on call. It's just a little checklist to let you see whether you're safe or not unsafe, and gives you, provides you with what you need to do. So it's just it's an assessment tool around your rapid risk. We've also got the Links Mentoring Program, and in the Links Mentoring Program, this is voluntary. We have mentors from rural and remote that will actually mentor new grads or those that are new to remote, and it's a program that you both the mentee and the mentor agree on a suitable time. Most mentoring programs, or those participants will work, or will be, the mentoring relationship will be for up to 6 to 12 months, depending on the needs of the mentee. The mentee will drive it. I can't stress this enough. It does accelerate your learning. It actually assists in you to integrate your clinical skills. It gives you opportunities to network. It enhances your knowledge base, and not only that, you're receiving professional support during the first 12 months of being in a rural or a remote setting. There's also a CRANAplus working for rural nurses. This is a little booklet that talks about all those preparation and tips that you might need, so you can actually download that from our website. Then Working Safe in a Remote and Isolated Handbook is also there for you that you can download. And then, of course, we have CRANAplus's resources, education and support. This is our core business here, and we also advocate on behalf of the remote workforce as well. But let me get back to education. CRANAplus has a gamut of clinical skills and courses you can register to undertake, such as the remote emergency course, the midwifery emergency course, midwifery for non-midwives, pediatric emergency course, basic life support, mental health emergencies, triage, cultural safety, to name a few. So go onto our website, have a look at what education has to offer, and you can register if you're interested. And the last thing I want to talk to you about is the importance about staying and being resilient, is our bush support service. It's a toll-free 24/7 support line. So that there will always be, there are trained psychologists at the end of the line. And like I said, it's 24/7. It's a confidential telephone counselling every day of the year for all remote health workers, service providers, and also your families. So there's the call line for you. It's 1800 805 391, and it's there for you as a new rural and remote nurse or midwife. So this ends my talk today.
Fantastic. Thank you so much, Marcia.
Thank you. So
sorry, I think I cut you off there.
That's okay. So best of luck for your future rural and remote nursing career. Any questions?
Okay, I think Chris, have you... Oh, here we go. There's one online. Chris, did you want to start it off there?
Yeah, sure. I can start it off, and maybe Pip, you were if you continue to compile the questions as they come in, I can ask a few questions if Marcia's happy to stay on and do that. I think we've got a good question here that's coming from Tara, just asking if you could outline a bit more on your career progression as a remote area nurse. So you mentioned many go overseas afterwards to work,
yeah.
But for those who stay in Australia, what's that progression like?
Okay, so my progression, I'm actually not a remote area nurse. I'm a professional officer that works with CRANAplus in the remote context. But my progression was, and they do say that, you know, people do change their career opportunities or career options as they go through. So mine started off in I worked in research as a research assistant. I worked with Flinders University and I looked at hysterectomy trials, further away from remote and rural as you can be. And then I worked in cardiology, did cardiology care, and then became a diabetes educator. So this is quite varied. And then I moved into being an educator for rural nurses and worked a number of years in the rural sector, going around to the rural hospitals and running workshops locally within the rural area of South Australia. And then they moved me into the Department of Health, and I was a project workforce development for the rural nurses and midwives, and ran a number of programs such as Midwifery Skills Enhancement Program, a mentoring program, just to name a few because I guess it's yonks ago. Yeah. And then from there I became a policy advisor to the Chief Nursing Officer in South Australia for a number of years. And then I moved into CRANAplus, into the remote sector as a professional officer, workforce development person. So that's my career in a nutshell, and you can see that I've chopped and changed my career as I've gone through. And it has been, with nursing, there's at least 70 plus different career pathways that you can take. But I think if you're really, really passionate about going rural and remote nursing, rural, I would encourage you to think of a regional, start off working in a regional hospital first, then going to a smaller hospital and building those skills and getting a variety of and a really good look around what nursing captures for you.
Fantastic.
And that's the question.
Yeah, well, I think it more than answered the question. That was fantastic, and such a varied career and wealth of knowledge for everyone tonight. So we've got another question that's come through on the chat. So someone commenting that it was a great presentation. Thank you very much. From your travels and from the time that you've spent, educating in rural areas, working in rural areas, what would you say is the best part of working in a rural area?
I think it's the recognition of being part of a community. I think it's also the fact that you never know what's going to come through the door, and so there's always that. I think it's just that. It's that sense of building your confidence and your capabilities, and it's that having that variety of different types of patients that are coming through the door, and knowing how to look after different types of patients. So I think that's the excitement for a lot of nurses out there, but also being connected to the community and being seen as well, you will be identified as having a high profile within the community, no matter where you work. But it will take you 20 years to become a local, I can tell you that.
Yeah, I think that would be for sure. We have, quite a few questions coming through. And we've got a question from, I think said Weena, saying that her ambition is to be selected as a grad staff at Cooma Hospital next year. I think based on some of the speakers across this series, she's starting to think that adding midwifery would be a great thing to do. So Marcia, from your experience, do you believe that she could study as well as take on first year as a new grad?
Say that again. Just say that question. Do you think she could study as well as take on her first year as a new grad? I think I would. This is from my perspective. I think I would actually concentrate more on consolidating the skills that you have actually learned as an undergrad. I would actually give yourself some time. Give yourself time to consolidate what you have learned and build on your experiences before you then go into the studies, because that's incredibly demanding when you're learning. I mean, to actually get used to shift work will be one of the hurdles that you're going to have to overcome, and that will take time.
Brilliant. I think you had something to add, Pip?
I think that's great. It's a really good question, actually, and depending on where you do your new grad as well will have a big influence on this. So I'm not sure if you were here last week, but we spoke to a couple of recently registered midwives and someone who was just recently finished their grad year and thinking, or in the middle of doing their midwifery program. And I think you'll actually need to firstly complete your grad year and get those skills underway. Yeah. Marcy's probably right that you need to be quite confident in those foundational skills. But if it is your passion to go into midwifery, then of course you could go into your mid-start program as soon as you're willing to do that. But if you want to combine the two, I think Marcy's got a very, very good point there, that get that strong nursing foundational skills there, then add your midwifery, and then you can go anywhere, really. So I think it's a really, really great sort of aspiration to have, a very doable one, but I totally agree with Marcy's point as well.
Thank you, Pip. Yeah.
Wow, we've got so many questions. This is great. So UTS, I went to UTS. So do you have any advice for a new graduate going to a rural area, like just out of the blue? Your talk talked a lot about things to look out for, but what would be your number one bit of advice? So we've got a third year nursing student asking that he's interested in going rural, and what's your best advice?
Sure. I think the first thing is first thing is to keep in contact with your family and friends. That's the first thing. The second thing is to visit our website and look up resources and look at the little brochure that we have got prepared for those that are thinking about going rural. And the other thing is to look after yourself. Self-care is the most important thing, and that is about building your resilience. And like I've said, one of the things I would do, and I did do when I first started, was I kept a little notebook in my pocket, and anything I knew that I knew that day on the shift, I would write it down. And then over time, I would flick back over my notebook, and it was very, I guess, comforting to know that I'd actually passed all that, and I didn't have to rely on looking at my notes or anything, and it's just was an indicator how much I had learnt along the way. So keep a little notepad and just jot down your new learnings. It's all part of being reflective. Now, we talk about being a reflective practitioner. It is very important to get into the habit of becoming reflective on your practice.
Yeah, definitely. I totally agree with that as well. So we've got another question here from Tara. So can you suggest an order of learning programs for those who want to be a RAN? So so for example, starting with your BLS and then maybe ALS in New South Wales. I know we have the FLEC program, but I'm sure there's a national sort of, best practice way to climb and to be a sort of confident and competent remote area nurse. So what would be your sort of suggested order of learning?
Oh, okay. Well, I think that the skills that nurses need out there is that they do need to have an understanding of emergency nursing. So whether you actually spend time doing emergency nursing course post-grad as or you actually do short courses, and FLEC is one course that you could undertake. CRANAplus has an emergency course that you could undertake. There are a number of courses that other organisations may offer. You just need to go onto the web and have a look and talk to people that have actually undertaken courses. I think emergency course, if you're going out to remote, you need to have an understanding of primary health care. What does that mean? Because it's an approach to care. It's about prevention, early intervention out there, as well as emergency care. And I think the other thing you need to have an understanding of is maternity as well. Again, what the regional hospitals offer out there in the bush is that the midwives tend to be part of a outreach, and they go out to little clinics and they do the post and prenatal care for those women that are expecting or that are postnatal and prenatal.
Great. Marcia, I've got another quick question, and given your background, this might be one that you can help with in terms of workforce. So are you able to provide a little bit of information about the current employment opportunities for RANs in particular?
The current employment opportunities?
Yes, like just some general advice on employment opportunities. Are there many jobs out there if the guys go down that route?
Yeah, I think, I believe that there are opportunities for nurses to become remote area nurses. By looking, if you check the vacancies, a lot of hospitals in Queensland, Northern Territory do advertise for, and Western Australia do advertise for remote area nurses. If you go to Northern Territory, they actually have a program for remote area nurses to do, and part of that is to do a postgrad and you can do a postgrad in remote area nursing through the Centre of Remote Health in Alice Springs. It's part of Flinders University. That's a postgraduate course. I would also recommend that if you're going remote as well.
Great, thank you. I think for anyone online tonight, if you've got any further questions or you would like some specific help with any of those sorts of employment opportunities, please, obviously there's great places and resources like the CRANAplus website and whatnot. You've got Pip and I, so please reach out. We would be more than happy to put you in touch with the best people to help you with those sorts of questions and to help provide guidance. So don't hesitate to do that.
Yeah, and yeah, please reach out, and I'm a telephone or an email away as well.
Fantastic. Thanks so much, Marcia. So we've got a question that's come through, and it's been sort of echoed in the last couple of weeks as well around accommodation. Can you tell us a little bit about the different types? You touched on it a little bit, but the types of accommodation that new grads may have in either the sort of rural and remote sites, probably the remote areas, because we've spoken a little bit about the rural areas.
Okay. So often you'll find in the remote areas, they often have a share house for clinicians, and you tend to share, you might have your own sleeping quarters, but you would actually share the house with other health professionals, and then also they have fly in, fly out, so you also may be sharing with the allied health professionals. Or you may even have accommodation that is just a little house by itself, but often you'll find that there's share houses out there.
Fantastic, thank you. So you mentioned in your presentation about CRANAplus doesn't sort of endorse single post nurses. Now you and I spoke a little bit about this today, but can you explain to some of our viewers what this means and why it's so important?
Yeah, so single post nurses is basically one registered nurse registered for a shift. And it's due to the population being very small, but you still have a very small clinic out there. Well, we don't advocate that. We believe that nurses there needs to be two nurses per shift, or two or more nurses per shift in those small clinics. They're still happening, but we do not support the idea or even the practice of a remote single post.
And that's really, really good to hear. I think I learned a lot about that when I was out working in rural and remote areas, and hearing you speak about that today was really reassuring, really good to know that we have support out there, and if things aren't lining up that way, that all of you guys now know, you reach out to CRANA and you reach out to us, and these things are available. Okay, so if anyone else, we'll do a few more minutes for questions. I don't think I've seen any more come through just yet. Maybe you have, Chris. But if not, that was fantastic. Thank you so much, Marcia. If anyone would like to touch base or ask more questions, or find out more about the opportunities of not only rural nursing but more sort of remote area, please do get onto CRANA. It's an amazing organisation. Reach out to us at RDN. We've loved being part of this presentation and series. We do have next week's session, which is a very different approach to the rest of our sessions, and it's all about Q&A throughout the whole series. So all those questions that you've been dying to ask and haven't got round to, or you've thought about after the session, please pop them in the survey. Chris is going to add it to the chat now, and let us know, because it'll be great to, we're going to have a few of our speakers back, and we'll be able to just ask a lot of questions and prepare you for your grad start applications, which I think come out in about 2 weeks now. Likewise, if you have any more questions about your grad application, please reach out. And otherwise, I think that's it. Anything more from you, Chris?
Nothing more from me. I've just posted the link in the chat. Yeah, thanks so much, Marcia. I think that was very informative for everyone, very enjoyable.
Thank you. Best of luck, everyone.